You're listening to the UBC Medicine Learning Network.
The way appointments happened previously was definitely a preventative factor in myself and other people accessing care. It just seems so daunting or time-consuming. It did take an entire day to get it done.
From UBC Medicine, this is The Listen. We present stories of virtual healthcare in context. I am your host, Dr. Kiran Veerapen, and today, rural virtual care and meeting the patient where they are. The COVID-19 pandemic has ushered virtual care into the spotlight. Virtual care is medical care across distance. Technology is the bridge, bringing patients and care providers together. In rural and remote regions of BC, where access to healthcare is a challenge, virtual visits have been a part of care for some time. Let's listen to our patient Faith describing her challenges.
So when I was younger, I didn't have a whole lot of interactions with the healthcare system. It probably had a lot to do with how far away it was to go to attend a doctor's appointment. In the wintertime, you're looking at least 2 hours to drive one way, and if you're in a sedan-type vehicle, the snowbanks are quite often higher than the vehicle itself. And it's a pretty narrow road, barely enough for one vehicle in each lane. And then in the wintertime with the snowbanks, of course, that narrows the road down quite a bit more. I'm lucky enough to have my own vehicle and to have a decent job that'll get me into town when I need to, but there's a 95% unemployment rate. Most of our residents are living off of social assistance, and that's to cover their food and other basic needs. Out of that money, they've got to find their way into town. People are quite often ignoring doctors' requests for follow-up or whatnot because it was just so far and so pricey for people to get into town.
We now join UBC Clinical Professor and Chair of Rural Health, Dr. John Pawlovich, for some insight on the importance of considering the context of your patient.
So I was born in a small farming community in northwest Alberta, a place called Spirit River. My dad was one of the country doctors there. The constant exposure to small towns and outdoors, my interest in medicine is something that just continued to grow inside me. And that's just something that I knew I wanted to aspire to. And so that's taken me on this journey. When you're dealing with rural and remote communities, whether you're writing a script for a medication or a treatment and it requires people to travel, that's not necessarily a benign exercise. We just don't see it with learners. We see that a lot I see that with colleagues, where colleagues suggest things that are like way out of alignment with reality of where people are. And part of the education is actually helping colleagues and peers understand that that's very well intentioned. And I'm appreciative of that, but that's unlikely to be successful due to these reasons. And that's a humility part that we all have the opportunity to learn something here from not only colleagues, but also patients. And that's where we need to keep nudging the conversation. Will this actually work? Can I afford it? Can I take time off? Like, people expect me to show up at 10 o'clock somewhere. That can't happen. Like, that won't work for me. That cuts back to the meeting people where they are part.
Engaging with your patients to understand the context of their life is key to providing a better patient experience. Current UBC resident Taiysa Rouault expands on the concept of meeting patients where they are and shares how learners with some work and ingenuity can provide better treatment solutions.
I grew up with a mom who was a nurse. We would be around the community, and so many of her previous patients would come up to her with their newborn babies and just express their gratitude. So I just grew up seeing the impact that nurses and healthcare had on patients and like the long-term relationship. And so I just really wanted to follow in her footsteps and do something within the healthcare field. As a learner coming into these communities, not knowing what resources or how far some of the outlying communities that you're serving and their patients, you have to really ask the doctors or nurses to make sure that you are providing the best care for them, because for them, that referral might not make sense, and you might actually be able to find someone closer in the community who will be able to service that population. And so, for example, in Fernie, you have to travel either to Calgary or all the way to Vancouver to see an endocrinologist. But sometimes you can find different ways around it, such as a pediatric endocrinologist who might be willing to take a little bit of an older adult just because of the lack of resources around. And so you're saving your patient 4 to 8 hours drive just to go see that doctor by being able to just call that pediatric endocrinologist and say, hey, would you be willing to see my 25-year-old patient? They're having troubles getting to these appointments. And often, not all the time, but sometimes they will, because they know how challenging it is for patients. So you just have to dig a little further and ask for help to be able to ensure you're getting the best care for the patient medically, but also socially, considering all their different challenges, because they may have like 4 kids at home and not be able to travel that far. You never know what their story is, and just really asking the patient what they want is really important.
For patient-centered care, asking the patient what they want is critical to meeting their needs. However, for many rural and remote patients, this type of care has eluded them. Traveling outside of their communities, patients can be vulnerable to a revolving cast of physicians and a lack of longitudinal patient-centered care. Let us now join Faith on one of these appointments.
You would first be greeted by the registered nurse on staff.
Hello.
They would do your vitals and whatever else is generally done when you arrive. Then you go and sit in a room. You could sit in there for 20 minutes to a half an hour just waiting for the doctor to come to your door. The doctor generally just comes in, quickly introduces himself.
Hi, good afternoon, Dr. Smith.
Sits down, and they're quickly flipping through your folder. And every time I went, I would make sure I wrote down all the concerns that I needed to bring up with him, or things that I noticed that were different. Because, it's not going to be long that you have with that doctor. So I'd start making my way through, and he would kind of just be like, look you through the pages. And it just seemed like they weren't even listening. And by the time he finished flipping through and then looks up and says,
So what brings you in today?
I just finished letting you know everything I needed to say, but we'll start again. There didn't really seem to be much opportunity to explore different treatment plans. It was the doctor's way or the highway, and quite often they only had one method of treatment for different things, and it was generally just to prescribe medication.
If you break it down to why people feel the way they do, are reflective of that more transactional journey for them with the healthcare systems. They go to a place away from their community where they have healthcare needs. And so people see them outside their community, outside their home, and they see them as more times than not as a medical problem as opposed to a person. And that's no one's fault. It's just the way it's played out. And so every time somebody interfaces with the healthcare system like that, they're seen as a medical challenge, in contrast to a person who lives in a community, who has kids and interfaces with all the other community members and where they live and so forth. There's no shortcut to that endpoint. It's not any more complicated than actually spending time and developing trust first. The primary bit of our work that I flag for learners and peers that come with me is the fact that we need to go there. We need to go to their communities, and we need to share time in their communities as much as we can. And there's no question that the greatest connections are made when you can stay in a community. The optimal would be for every community, no matter how small, would have a resident physician and healthcare team in their community. That's something we should aspire to, but it's probably not obtainable for different reasons. But I think we should work towards as close a model where healthcare providers actually go embed themselves in communities for extended periods of time to, first and foremost, get to know people and develop the trust. And you got to remember, Indigenous people have a history of people coming and going, people leaving them. And so I remember one of the most powerful comments made to me by a patient was in a community that I've been going to for many years. And I was sitting in there in the health center in their community, talking to them. And we were talking about things. And that patient, just out of the blue, asked me, he looked at me in the eye and says, "When are you going to leave, Dr. John?" Yeah. And I remember that hit me like a ton of bricks.
As a learner, I think we get a little bit of the benefit of the doubt. Patients are usually super open to having learners, and they just want to share their story. And we have a little extra time compared to our preceptors. It makes it easier to build trust because of the time. But I know as I get into residency and then becoming a practicing physician, I'll have to improve on being able to build that rapport and that trust by understanding the whole patient, but in maybe possibly a little bit shorter and more concise way, so that I'm able to provide care not only to that patient, but to all my patients. Trust is huge. And if you don't understand a patient fully, it's really hard for them to trust you. And I think that's what also comes with longitudinal care and seeing someone multiple times. So knowing that, that first visit, the patient's not maybe going to trust you right away. You can start to build those building blocks, but it's going to take time. And so if you're one of the fortunate physicians who gets to follow people longitudinally, it's asking those questions of how's your family and all those small things that go a long way, taking that time to really understand the patient and meet them where they are and really understand the whole them and not just the medical issue that they're presenting with is so important.
As Dr. Pawlovich and Taiysa have shown, building trust between physician and patient is not only important, it takes time. Trust is longitudinal, and virtual care is a way of enabling a longitudinal relationship. Let's listen to Faith's experience with virtual care.
When I returned to community and was kind of nervous about that, and I was getting closer to the 1 month mark, where you'd have to have your first well baby check. I had a notice delivered to my door, and on that notice says, Dr. John Pawlovich coming to the community on this day. If you'd like to have an appointment, call the health clinic. And I thought I was reading it wrong. I was like, really? Somebody's coming here to this community? And so I called, and sure enough, he was indeed coming to our health clinic. And so I was pretty excited, but kind of nervous. I wasn't sure what to expect, and came up with my new baby and met Dr. John and his team for the first time, and was pleasantly surprised with his demeanor and how it was just to come here and be able to just walk up the street, having to wait only a few minutes before being seen, and doing the regular well baby checkups, and then having the question of, was there anything else you wanted to discuss? And I was kind of surprised, and I was like, I didn't really think about anything else because I was just here to get the baby check done. Of course, after I'd seen him, I was telling my family and everybody else who would listen to me that this doctor who came was really friendly and actually wanted to know if there was anything else that I wanted to discuss. And it was kind of surprising for a lot of us to hear stuff like that. With the addition of telehealth, it was like having a doctor here in the community every day, because we would just email or call, and they'd give us a time where we can be in front of the machine. And more people started coming to see the doctors about everything that they were experiencing. And I think that more people just got more involved with their healthcare, wanting to actually deal with issues rather than shrugging them off as, oh, well, not going to really interfere with my life.
One of the modern day beliefs that you commonly hear is that, you can't develop relationships over a virtual medium. You have to know people first. That's the way. And there's a lot of truth to that. There's no question that virtual health works best where people have an existing relationship. I would firmly support that notion. However, what I've learned is that, like everything, nothing is absolute. And a patient taught me that about virtual health very early on, where I met them in a community that I'd never been to. Neither the patient nor I had ever met each other physically. And I helped them. It probably spent about 45 minutes with them sorting out their needs. And at the end of that, I always spend times asking them at the end of our time together on this virtual interface and say, how did this go for you? Because I'm just interested. I'm just kind of new at this, and I wonder what this is all about. And I remember they said to me very clearly, unequivocally, said, Dr. John, and why people call me that all the time, reflexively they do, but said, without question, this is the best doctor visit I've ever had in my life. And this person was in their late 60s. And perhaps that's just a sad reflection of our healthcare system, but I like to think that it was more a reflection of the goodness of the interaction that just had happened. That patient taught me that with the proper interactions and skill set and awareness, mostly human awareness, that you can establish relationships, you can establish trust, even in the moment where people haven't spent time together. If you focus in and ensure you humanize the experience, and the technology fades away into the distance. So traveling long distances, spending time in communities, making home visits, month after month after month, and then bridging those times with virtual interactions really became normalized over time. And certainly we had a 10-year head start prior to COVID arriving. And for our communities and our healthcare team, we just dialed things a little bit more to the virtual care side of our work. And we really never skipped a beat. And to this day, I'm still heavily weighted on the virtual side of things, trying to limit community exposure of a virus that I could potentially bring. And so meeting people where they are is optimized through the technology. And that's what I think our community members, our patients have come to really appreciate.
Advice for future or incoming learners into the virtual care environment is just to continue to use those skills that they've taught you in your clinical skill settings and your communication skills classes, because really everything they've taught you to do in person can be done over the phone. As much as it's surprising and you think that you can't do it, try and be creative. You can ask someone to do a lot of your neural exam or range of motion and muscle testing through Zoom or over the phone. So being able to just take a step back, think outside the box of how can I make this work? Right now you're in the best situation where you just get to learn from your patients, from your preceptors, and try things out. And so if you don't do it right the first time, that's okay. That's why you're a student and you're learning, and it's no different virtual care versus in person. Just being eager and taking every opportunity as it comes is, I think, really the best advice I can give.
Understanding the patient's context, involving them in finding solutions, and building trust leads to better outcomes and a meaningful patient experience. I'm Dr. Kiran Veerapen, and this has been The Listen.
This has been a presentation of the UBC Medicine Learning Network.